Hey guys, it's Dr. Justin Marchegiani here. Happy Friday. Looking forward to some phenomenal, great questions in the health world and functional medicine land today. Hope everyone's doing great. I'm going to enjoy a nice little sip out of my butter coffee. Hope everyone else can grab a beverage and come on up. All right, so we got a bunch of questions already here on the queue. So why don't we start digging in? Let me see here what we got here. David writes in, have you successfully treated or cured ITP? I'd have to look up what that abbreviation is. If you can write what that abbreviation stands for, that would help. What prep do you recommend for GI test to be as accurate as possible? It depends on the GI test. A lot of the antigenic tests where they're looking at things under a microscope, they stain the slide, they look at it under a microscope. That's going to involve, being off probiotics, being off enzymes, being off antimicrobials, antibiotics for at least a week. Sometimes even 2 weeks for the probiotics, but typically at least a week. Some of the more comprehensive tests that are more DNA based are a little more sensitive and don't necessarily need that higher prep time. So that's, one thing that we look at is the newer tests make it a little bit easier, which help a lot. Hope that helps there. And anyone on Facebook as well, feel free and chime in with any questions. I'm trying to pull up the questions here on Facebook on my computer here on one of the side screens, just because I can't really see them as well on the phone. It just gives me the first 2 sentences, then a ... and I can't read the whole thing without going out of the app. So I'm going to try to pull it up on my computer here so anyone on Facebook can also engage in the conversation. All right, cool. I got something going here now. That's awesome. Just pulling that up. Oh, great. That works. Awesome. Okay, cool. Tony writes in, ITP may occur when the immune system mistakenly attacks platelets. In children, it may follow a viral infection. Symptoms may include bruising, bleeding, pinpoint side reddish purple spots. In children, ITP usually resolves without any treatment. Again, with ITP, basically what I'm hearing is an autoimmune component to it. Anytime we see autoimmune issues, the first thing we always think about is highly inflammatory foods that drive gastrointestinal permeability. So gluten, dairy, obviously refined sugars, those kind of foods. So getting the autoimmune diet in place is going to be important, especially with kids. There's a general cascade that happens. Kids are, vaccinated right off the bat with Hep B, right? So that's like an immune stressor. And then they also have, if they're being breastfed, that's great. If they're being breastfed and the woman's eating a good diet, even better. But typically when they transition off, let's say to a Similac kind of formula, it's 60% high fructose corn syrup, right? So there's going to be more insult there. There's going to be dairy and casein getting through that typically corresponds with or will start to equal like an ear infection. They get some kind of infection. A lot of times it's an ear infection first. They're put on antibiotics. Then it recurs again a month later, more antibiotics, and this vicious cycle of antibiotics, rebound overgrowth. They start getting yeasty. It starts messing up their microbiota. That creates more leaky gut. 80% of the immune system's in the gut. So then you start to have immune dysfunction because of the microbe imbalance, the chronic gut stress, the immune permeability from the gut lining into the bloodstream. So all of these things compound and make the immune stress a lot worse. So getting all those things addressed is going to be essential. So with, rare underlying conditions, there's like 180 autoimmune conditions, right? They all have a similar mechanism. How and why they express is typically going to happen with the timing of the insult and a combination of genetic predisposition. Hope that helps there. Let's see here. Dr. J, what can be the reason for meat causing gas every time I eat? Every time eaten, and vegetables like carrots also cause severe smelly gas. So number one, they're low hydrochloric acid levels. So a lot of people, especially in the vegan vegetarian community, they're just like, well, I just don't feel good when I have meat. It's like, well, you may not feel good because you're eating a food that's going to stress the hydrochloric acid and enzymatic systems of the body. And if those systems aren't up to par producing enough HCl and enzymes, yeah, you may feel like that food is a stressor, isn't good for you because the food's inside of you. It's acidifying, it's putrefying, it's fermenting, aka it's basically rotting inside of you, right? Of course, you're not going to feel good. The analogy I tell my patients is imagine going to Whole Foods, getting a whole bunch of perishable goods and just leaving it out on the counter for a week. Well, even that food's really good, it needs to be in the refrigerator so it can keep, right? So that's kind of the mindset with hydrochloric acid and enzymes. And a lot of plants, especially if you're doing a lot of plants have a lot of intact enzymes, so that can help. Of course, raw veggies and things like that may be a stressor too. So I would look more at the gut. I'd work on supplementing enzymes and hydro. And if it's a repeated thing with just those certain foods, then I'd pull those foods out. There could be a FODMAP component with some of that. Carrots aren't high FODMAP. That may be just some kind of other allergy. And also, we can't lose sight of the fact that chewing your food adequately makes a huge difference. Chewing your food breaks the food down. It increases the surface area of the food, which allows the enzymes and the hydrochloric acid to work better. So keep that in the back of your mind that that's going to be really, really important. All right, let me keep going here on Facebook here. Yeah, so Tony's question was that's idiopathic thrombocytopenia. So yeah, abnormal platelets or blood cells. Got it. Hopefully that answer helped you out there. So work on all the same things to help with the autoimmunity that we do in the past. Leaky gut, diet, AIP, all those things. Of course, if it's a child, baby, you really want to get the breast milk and dialed in. Make sure the mom's diet is great as well. What test would I recommend for that? I mean, typically we're going to run a comprehensive stool test depending on how old the child is. We may even do an organic acid test to get a window of what's happening there. Charlotte wants to know thoughts on utilizing uBiome to optimize bacteria species. So the issue with uBiome is it maps kind of the broad spectrum of the microbiome, which I think is helpful. The issue is if there are certain infections present in the gut, that can throw off the microbiota. So you can be looking at like, oh, well, I need more of this bacteria versus that bacteria. And you're basically trying to rearrange the deck chairs on the Titanic, essentially, right? So you're not getting to the root cause. The ship's sinking, right? So we don't have to worry about manipulating where the chairs are at. We have an infection in the gut. That's why the bacteria is off like that. So we always want to look higher up and not get caught up in that deck chair analogy. So I hope that makes sense. Getting to the root infections is going to be, in my opinion, more important. Okay, here, dead probiotics versus live ones. I mean, you want to use a good probiotic formula that's going to make sure that the probiotics are intact. You know, when we put probiotics in the capsule, you know, we say, hey, this is how much is going to be in there at expiration 2 years later, right? So some companies will do it kind of best case scenario in the moment where they're at then. And then some companies will do it saying, hey, this is where we're at now, but this is where we expect to be in maybe 2 years. So they always overestimate, or they always underestimate, I should say, based on the worst possible circumstances, so you know what you're getting. Let's see here. Let's see what's next here. Okay, I'm trying to get through this. How to take care of our stomachs. Let me see. There's a lot of side chatter here. Let's see what the next question is. Is there a limit to how much pea protein or collagen I can take in a day with your line? I'm weighing 130 and trying to gain weight quick while I clear some infections. Typically, I would say 1 to 2 servings a day I think is fine. I look at protein supplementation as number one. It's a quick replacement meal. If you're on the go, you want to get at least 2 meals a day, right? That's my goal, at least 2 solid meals in a day. If you want to use protein supplementally, like you do a green drink and you're going to add some protein to it, well, then you get concentrated veggies. Maybe you add some MCT to get some good fats, and then you add a little bit of protein. That's a perfect match because you're combining real food with some good fats and with some good proteins, and that's helping. The other side is protein is pretty difficult to process, meaning 50% of the energy of the protein actually gets processed, actually gets used up in the digestion process. So if you're someone that's already like really catabolic, you're really stressed out, you're already breaking down at an accelerated rate, protein powders can be helpful because it's giving you amino acids that are already broken down, so the body doesn't have to do much to access those amino acids. So I would say 1 to 2 servings a day. I would say a replacement meal, and you can mix it and do a smoothie kind of action with it where you're adding real foods to it. And then maybe something supplementally later in the night or post-workout, I think is great. That way you get a good, maybe an additional 40 grams of protein a day. Again, collagen's great because most people aren't getting exposed to collagen amino acids, right? Most people aren't eating the skin, the connective tissue, the joints, the knuckles, the cartilage, the ligaments. They aren't getting exposed to those kind of amino acids. So I think it's great to get those supplementally. So it helps with all the hair, skin, the nails, all those really important things. Plus, collagen's really high in glycine, and glycine's great for the gut lining. So if you have leaky gut issues or GI permeability, that can definitely help. Let me keep on rolling here. A lot of questions here today. Whoa, man. All right. I take HCl with pepsin when I eat animal protein and when I don't eat animal protein. I take HCl by itself, but it gives me reflux. I know that even if I eat vegetarian meals, I need HCl, but it doesn't go well. Yeah, I probably would cut the dose down of HCl with your vegetarian meal. Depends what your protein sources are. So if you can give me a more specific kind of overview of what that looks like, but I'd probably cut if it's primarily just plant stuff, I would probably do no HCl and just focus on the enzymes. That's what I would do if you're having that experience. If you're doing some protein, like you're doing some legumes or something like that, or lentils, maybe a half a cap, or maybe just do the apple cider vinegar before it. I would do that instead. Okay, let me keep on rolling here, guys. All right. Jeff's right back in. I think with gut infections like H. pylori, it can cause you to have negative thoughts and anxiety attacks. I was doing better when I had the hormones to support. Is it possible infection causes it? Yeah, absolutely. Because H. pylori is a gram-negative bacteria. I mean, it's got two cell walls, right? Think of a castle. Castle has the moat and it has the castle wall. It's got two protective barriers. The outer cell wall, right, in the gram-negative bacteria is LPS, or endotoxin. So that's like having the moat in the castle, maybe putting some kind of acid or poison in the water. So that's the analogy with the castle. But in real life, that LPS is toxic on the liver. So yeah, it definitely can create toxicity, put more stress on the body. And if LPS gets through the gut lining, which if your gut's leaky, it can go to the brain and it can create anxiety and mood issues. That's why blood sugar is really important. If you're having those issues, adding the ginger tea and adding extra activated charcoal to help bind up some of that LPS, and that's going to be essential to decreasing some of those symptoms. And with you, Jeff, you've been going way too hard. You got to back off and then gently taper it up. You're like pushing it like to 10th gear, and you're probably your own worst enemy here, causing way more die off than should be there. You should need to come off it, and you need to taper it back up gently. When you start hitting the wall, you need to back off. You need to add more gut healing nutrients, more binders, more ginger tea. You got to slow it down. Can there be too much of a good thing, adding ACV throughout the day while taking enzymes and HCl throughout the day as well? I would say you probably don't need ACV if you're taking HCl. I typically only recommend ACV if you aren't taking HCl and you want to just start increasing the acidity. That's a good first step. If you're taking HCl, you probably don't need it. Again, there's some good health benefits to ACV because it can help with guanidine metabolism, which is the byproduct of protein. And there's some good mineral mobilization effects with apple cider vinegar. So, yeah, I'm fine with a tablespoon or two. I don't think that's a problem at all. What type of test should my 73-year-old dad request to get his colon and small intestine checked? Well, again, what kind of symptoms are going on, right? That'd be helpful for me to know. But I would say a good comprehensive gut test would be helpful. So like if you go to my site and you look under lab test section in the Healthy Living store, the GI map test would be the one I recommend. I'm taking HCl with enzymes. How do I know if I should take bile salts? Well, does your stool look more clay colored or blonde? Is it floating? Is it floating? Again, that typically means maldigestion of fat. If those are true, then that's what I would look at next. See here, Jessica writes in, TSH is at 2.44, free T4 is at 1.1, free T3 is at 3.3, on Armour 15 milligrams. So that's only a quarter of a grain. When I first went on Armour 2 months ago, TSH went from 2.4 to 1.4. Now it's back at 2.4. Your levels look pretty good. I like, TSH between 0.5 and 2.5. I like free T4 between 1 and 1.5. You're 1.1. I like free T3 above 3, 3.3. I would say maybe you want to go up another eighth to a quarter of a grain. I'd be okay with that, but overall looks pretty good. Maybe divide that in 2 doses. What's your opinion on alkaline water? I only like water to be alkaline if you're actually adding minerals in it, right? If you're maybe adding some potassium or magnesium drops in there, that I'm okay with that. But if you're just, adding something more synthetic in there, then probably not the best, especially when you're pushing water up to a pH of like 9 or 10. Typically if you add a little bit of minerals in there, maybe it goes up to 7.5, something like that. I don't think going to that extreme is going to be the best. Dr. J, my eye is better. I have central serous retinopathy, or central serous retinopathy. I haven't had my bulletproof coffee in a week. They say caffeine could be the driver. What do you recommend? I miss my coffee. I'd probably just go to a decaf coffee. Just make sure it's really good, high quality. It's organic. Pay a little bit more for it. I'm okay with it. There's a lot of nutrients that are in coffee, and if you use it as a vessel to get some awesome fat in your body, I'm totally fine with that. Again, bilberry, resveratrol, curcumin, just lots of good nutrients to help with inflammation in the eye. I think is great. Obviously, if you want to throw in some extra cod liver oil, that's phenomenal because of the vitamin A will help the eye as well. All right. Let's see here. Carlos writes in, what can happen if I don't get 7 to 8 hours of sleep, but instead 5 to 6? Weightlifting 3 times per week and eating keto and IF, I feel rested and have energy all day long. Well, that's good. I mean, number one, on days you're lifting, you're probably going to need more sleep. I think you're burning the candle at both ends if you're only getting 5 to 6 hours and you're lifting. Like myself, I can get about 7 hours and do really well. If I start exercising more, I definitely need 8 hours. So you got to feel that out. I'd say with that record, you need to get a couple hours more for sure. I think it's a short-term solution. Asian masseuses who spoke very little English suggested him to check with his doctor as he found something under his left foot. Dad says he felt a lot of pain in that section under his foot. Okay. I'm not sure what the issue is there. Could be some type of ganglion cyst. Not sure. What is the cost of cause of light brown stool? It's only of the color. Well, again, what typically makes up the stool is going to be like stercobilin, which is like part of like the bile salts from the gallbladder. And that basically oxidizes based on it moving out the intestinal tract. So the faster stool moves out, like the more green it looks, the longer it goes, the more brown it looks. But if it's looking more clay colored or lighter, it could be more fat in the stool. Again, you're going to know it'll tend to be more shiny. It'll tend to float more, or it'll tend to be hard to wipe or like more streaky. Okay, keep that in mind. Let me go back to Facebook here, see if I have any more Facebook questions. And by the way, guys, I'm jumping on a podcast right after this call. So if you're enjoying this chat, we're going to have a great neurology podcast on brain injuries and how to recover from them. It should be phenomenal. So stay tuned right afterwards. I'll be back when we wrap up this chat in a few minutes, I'll be back like in 5 or 10 minutes. So stay tuned. Go back to justinhealth.com or go back to youtube.com/justinhealth and look for that great brain injury podcast. Neil writes in, I'm slippery elm, DGL, and ginger. Any other supplements you recommend for acid reflux? Thanks for the the good advice. Well, off the bat, make sure the foods are dialed in. I mean, if you're taking in refined grains or refined dairy or refined sugar, that can easily cause acid reflux. If you're having a lot of burning off the bat, go higher on the enzymes and lower on the HCl. You may even want to just start with a little bit of ACV or even just a little bit of lemon juice because it's got a little bit less acidity, or even just maybe a quarter of a half a capsule of the HCl. Mix it in your food and take it that way. I would do that. Make sure you're chewing your food up well. If you're still having issues, maybe throw it into a crock pot and blend it up to make it easier to process. Let's see here. Jeff writes in, GI Clear 1. Right now, only GI Clear 2, and a lot of my ulcer burning pain has gotten a lot better because I went off it for 6 days. Good. You're doing a great job. Keep it up, Jeff. Dr. J, what is for lunch and dinner? Have you tried Tom Brady's avocado ice cream recipe yet? Yes, I have tried it. It is good. And for dinner, my wife is actually taking me out. I had my birthday last week, so she's taking me out for sushi this afternoon. I am really excited about that. We'll do sashimi. I may have a little bit of white rice in it, but I'm going to bring some enzymes. I'm going to bring some activated charcoal. I'm also going to bring some MCT oil and coconut aminos instead of using soy sauce. So good, better, best. Let's see here. Guillermo writes in, that was the reason for previous question about colon and small intestines. So yeah, if we're talking about lab testing, the GI map would be great. Jessica writes back in, when I jumped to 30 milligrams of Armour for 3 days, I got really swollen legs and hands. It was scary. I also got ringing in my ears. Okay, so when you went from a quarter of a grain to a half a grain, you got more swollen legs. Well, I would look at potentially doing it twice a day. So like a quarter of a grain in the morning and then a quarter in the afternoon. That may be a good option. Or even you may want to just think about taking that quarter of a grain in the afternoon with food to decrease the absorption. That may be another good option, is do the morning one fasting and the afternoon one with food to make it more like an eighth of a dose. If you can get an eighth, if you can break it up into an eighth, that may be even better. But see what you can do. Let me know. Why would my TSH go up a whole point? TSH can fluctuate. Being between 1 and 2 isn't that big of a deal. Just make sure when you're doing the test, it's at the same time during the day so you get consistency. And also make sure you take your thyroid support after the test, not before, because that will artificially lower it and raise it. So make sure you're taking your thyroid support after and you're doing the test at a more consistent time. And again, if there's any autoimmunity, that could easily fluctuate it as well. So you didn't show any antibodies, so I'm assuming that there's not any autoimmunity. How can I take activated charcoal while taking GI clear herbs to help with die-off reactions? Take it, hey Nora, take it 3 hours after your food and 1 hour before. So that means you're taking it about 3 hours or so away from herbs and food, because herbs are typically taken 5 minutes before food. So you're taking about 3 hours and 5 minutes after food and herbs, and then an hour before. So that's going to be a great way to do it. That way it's not going to be binding that up as much. Genesis writes in, are orgasms a good idea if you have chronic prostatitis? Well, an orgasm involves the sympathetic nervous system. You know, the foreplay leading up to that's parasympathetic nervous system. So most people, when they're super stressed out, they're going to have premature ejaculation or premature orgasm because their parasympathetics can't hold that stimulation. Right. So I would just say, as long as it's not causing pain, I mean, you know, as ejaculate comes out of the prostate so swollen where it can't come out, then that, you know, you may have to go see a urologist and get expert take on that. I don't know how bad your prostatitis is, but getting the inflammation down, you know, lowering potential metals, getting the insulin resistance under control, all those things are going to be super helpful. Alma writes in, I cannot tolerate any digestive enzymes or probiotics. I get malaise and my upper back turns for about a week. Okay, so no enzymes or probiotics. So I would just start with some HCl. I would start with some HCl, take it in the middle of the meal. If that's an issue, then we may want to look at even just doing something like some bitters or a little bit of ginger, or doing some lemon juice. That may be a great option. What causes changes in taste sensitivity? Improving zinc levels helps a lot with the taste buds. That makes a huge difference. Getting your zinc levels up can help improve sugar sensitivity. Any recommendations for neuropathy pain? My mother is having leg pain, possible pinched nerve in her neck. Doctor is giving her Advil. Any suggestions? Well, get the pinched nerve fixed. I would do liposomal curcumin to help with the inflammation. And then for any neuropathic things, we can up alpha lipoic acid is going to be really good. Benfotiamine, liposomal B1 is going to be phenomenal too. Jazz and Justice writes in, great show. Thank you. I appreciate that. Thank you. Is it okay to take herbs before going to sleep? Depends what kind of herbs. If they're herbs that are modulating and helping to reduce stress, maybe like a valerian or a lemon balm, I'm okay with that. If it's a holy basil, I'm okay with that. If it's ashwagandha, I'm okay with it, especially if it's helping to relax you and not winding you up. I'm totally okay with that. Valerian as well. Everybody should give your video a thumbs up. Appreciate it. If you're listening right now, give me a thumbs up, guys. Give me a like, give me a share. If you want to tune in more, Facebook's only going to give you these videos if you're subscribed and you hit the bell. So make sure you hit that bell. I'm doing more of these videos to provide great information. Let me check out Facebook real quick. Any more questions there? I don't think so. So stay tuned. I'll be back in like 5 minutes. All right. With a great doctor. We're going to be chatting about brain health and brain trauma and what you can do to help prevent it, or if you have it, how you can treat it. So look forward to coming back real soon. You guys have a phenomenal Friday. Talk soon.